And you're welcome to, well, what we call our health segment. Now, today we have with us Daniel Olubumi and Elizabeth Adewale. I'll tell you why they're here. So from last week, we started something because it's, well, let's call it World Physiotherapy Month. It was World Physiotherapy Day on Friday, if I'm not mistaken. So we're using the entire month to celebrate World Physiotherapy Day. And that's why we have Daniel and Elizabeth here with us. And you guys are, well, fully representing the movement for physiotherapy and World Physiotherapy Day. So first of all, I wanted to ask you what physiotherapy means to you guys individually. Not the textbook definition now, but as individuals, how you apply it in your lives. Can I start with you, Daniel? I know it's ladies first. That, for a reason, Daniel is going to go first, and you guys will find out why in a minute. So Daniel, please.
All right, thank you very much. So basically, physiotherapy is physical therapy. We help people we rehabilitate people from the abnormal state of health to the normal state of health. And we use physical modalities to treat our patients. You know, anything that affects movement. So we try to rehabilitate such individual to the nearest state of health, to the nearest possible state of health.
Okay. And Elizabeth, does it have to be because of an accident or an ailment that one would need physiotherapy?
No, not necessarily an accident or an ailment. It could just be a decline. Let me put it that way. A decline is a better word. I mean, there's a perfect state of health, and when there's a decline from perfection, I think it's just to restore. I would really like to put physiotherapy as restoration and bringing back from almost good to good.
Okay, that's fantastic. Now today we have a specific theme, and it's physiotherapy for pregnant women. Yes.
Yeah, low back pain conditions.
Low back pain conditions. But what causes this especially? Is it because of the weight of the baby on the pelvis?
Yes, there's
And does this affect every woman who's pregnant?
Majority, at least 99%.
Okay, that's why they always do this when they're walking. I get it now, for extra support. So today you're going to be showing us a bit of demonstration of what pregnant women or people in general can do when they have these lower back pains, yes?
Yes, exercises to help them relieve the pain during the course of pregnancy.
All right, great. And we have our pregnant woman here. Ah, there you are. And that is why he went first in the discussion. So Daniel is going to simulate our pregnant woman, and you're going to give us the, demonstration, yes?
Yes.
I'm going to move you guys over to our mat here.
Okay.
Momentarily. If you guys come on over, and I'll let you guys proceed. Daniel, you want me to help you with that?
Thank you.
You are welcome. Thank you very much. Step this way. So, now, but Daniel, something is missing.
Okay.
Something is missing, Jared. We're pregnant woman. Put this on.
All right.
Can you go in?
Yes, it will go in.
It's okay in.
Did you not see MM when MM was pregnant that year? Thank you very much.
All right.
There we go. All right. Alrighty now.
Okay, so usually there are so many reasons why low back pain occurs in pregnant women.
Okay.
One of it is postural change because the center of gravity moves forward in pregnancy and it causes like a strain on the pelvic floor muscles and the spinal muscles as well. Another thing is weight. I mean, the size of the bump. A lot of pregnant women gain weight in pregnancy and that causes pressure as well.
Okay.
So basically, we're trying to avoid pressure being on the back muscles and the spinal muscles.
Okay.
So one more thing that causes low back pain in pregnant women is hormones. So during pregnancy, there's this hormone that the body releases to loosen the stress of the muscles in the pelvic floors and also to loosen the joints. And this can cause immobility, thereby leading to pain. So in pregnant women, first off, before these exercises, there's something to avoid. Do not stay on your back for too long.
Oh, okay.
Because you're putting pressure on the back muscles and there are major blood vessels on the back that can be affected in the course of passing blood to and fro your body. So it's usually advised to do most of your exercises in side lying. And another thing to look out for is to listen to your body. Of course, I can be pregnant and be more active than you when you are pregnant. Or I can be pregnant and be able to do things for 5-10 minutes before getting tired. And then there's another pregnant woman that can go 30 minutes, even longer. Right. So you listen to your body. Now, some of the exercises to relieve pain in low back, you have to kneel, 4-point kneeling. You kneel 4-point.
That's a very active pregnant woman.
Yes, so to relieve the tension on this back, you can do alternate arms, this arm and this leg. No, the other leg. Yes, so you stretch it out.
Oh, Can a pregnant woman keep that posture?
Not for too long.
Not for too long.
So you do this alternated release. You can count 5 seconds, you release both.
Okay.
Then you do for the other part too.
Okay.
Daniel, the other one.
This
Daniel.
hand.
Okay, this one.
Pregnant woman style.
Pregnancy brain. Yeah.
Then stretch this leg out. So you count 1 to 5 and you release. Another thing you can do is to bend your back in and out.
And out.
In, out. Other exercises to do, you can sit back in sideline.
Sorry, ma.
Sorry.
Well done, ma.
So you can do the both pelvic teeth, your legs.
Okay.
Rotate them. Alternate.
Rotate.
Yes.
Okay.
To reduce the tension in the sacroiliac.
So you keep going
yes,
like
back,
so.
Back and forth.
Okay.
You can do knee to chest exercises also.
Okay.
You just bring out your knee and you take one knee up, not too much. Bring it back. Take one knee up, not too much. So the beauty of this is, aside being a pregnant woman, you can sit up.
Sit down, ma. Thank you, ma.
So aside being a pregnant woman, you can actually do this as a non-pregnant person too. When you have low back pain, these are exercises that are common that you can do in your house if you experience pain, acute pain, subacute pain. Of course, when it gets to the chronic pain, you have to visit a doctor for the right regimen and drugs if necessary.
So what trimester or what point of pregnancy should you start these exercises?
Usually, the pain begins in the 2nd trimester when the bump start getting bigger and putting more pressure on the pregnant woman.
Okay, and then I've seen dancing pregnant mothers, women. Is that healthy? And they can be very rigorous when they dance, you know, with all the pop locking and everything. Is that okay?
Yes, it is. And like I said, listen to your body. So women are stronger than each other, and naturally, people are stronger than each other. Let me put it that way. So like I said earlier, I can dance for 20 minutes and not get tired, and you can dance for 45 minutes, 1 hour, and keep it going. So overall, it is good to stay fit. I think that's what dancing does. It's like a form of aerobic exercise where your large muscle groups are involved. So it is very, very advisable to actually do all of those exercises.
Let me bring you guys back to the couch already. Thank you very much for that short demonstration. Thank you, ma'am. Thank you very much, ma'am. Thank you, other ma'am.
Thank you.
That's very interesting. So I'm hoping that you didn't miss our demonstration there for pregnant women when it comes to physiotherapy. Daniel and Elizabeth here did a very, very good demonstration. And Daniel, an Oscar for you for being a pregnant woman there. So what role for the partners when you have a pregnant wife? What's your role?
As
Daniel, please.
Partners, right?
Yes.
You mean the husband?
Yeah, the man.
So, more like she already explained about the exercise. That's what we do in physiotherapy. So exercise is very important. And as case may be, we always employ that clients, as case may be, should bring their partners. It's profiled like a social, emotional support for their wives during pregnancy. Even while carrying the exercise. And also, during the exercise, it's also very advisable that someone is there to stay with them.
Yeah.
In cases where maybe something wrong might happen, and because a lot of people, like a lot of pregnant women, they tend to skip meals during pregnancy. And you cannot skip meals and you expect you to perform those exercises to the, to the fullest, you understand? So someone has to be with you while doing the exercise to prevent anything. So then also the emotional support.
My final question has to do with certain other exercises that happen between a man and a woman, especially during pregnancy. How far can you take it? How far can you exert a pregnant woman, especially that you're a physiotherapist? Could you hurt your partner if you overdo it in bed?
So there are pregnancy safe
I thought he was going to
positions.
answer, but you have more expertise, so please go ahead.
They're actually pregnancy safe positions.
Okay.
The doctor is going to advise you on all of that. none of this affects both the mother or the baby. So I think
So there's specific positions that are
yes,
best for
yes,
pregnant
for
women.
pregnancy.
Okay, it would be good to know what these positions are for people who have pregnant partners out there. What are they exactly?
Well, so like those exercises are supposed to be, exercise are quite individualized.
No, I'm talking about positions now. We're talking
Positions.
about positions during sex. So I'm like, well, it would a backward entry be better than a forward entry, for instance? To I don't know how these terms.
Well, I think a sex therapist will be in that position to, to administer.
Well, after all, you guys are physiotherapists,
Yeah,
so let's
exactly.
leave the sex to the sex experts. Fantastic. Don't put yourself in trouble. Fantastic. That was good. Thank you very much, Elizabeth. Thank you very much, Mrs. Daniel. That was very exciting and interesting segment right there. And well, I'll be looking out for you guys, especially throughout the entire month of World Physiotherapy Month.
Yes.
And please let Nigerians know more about their bodies, their movements, and how they can, continue to take care of themselves. Now, to you out there, especially if you are in a family or already in a family way, you must have learned something. We'll bring you the other segments that involves, maybe tomorrow or next week. Stay tuned.